content creator Lin-Manuel Miranda says he's been diagnosed with shingles. Miranda tweeted Wednesday that he had one of the worst headaches of his life. It turns out that was just a symptom of the viral infection. The star says he caught the virus early and is quarantined. Miranda is not alone. The Centers for Disease Control and Prevention estimates 1/3 of Americans will get shingles in their lifetime. Here with more about the virus is CBS News chief medical correspondent Dr. Jon LaPook. Dr. LaPook, before we get into this, I just want to warn our viewers. We're about to show some rather graphic photos. Maybe not a great story for dinner time, but you can still listen because this is important. First of all, what is shingles and how does one contract it?
All right, so this is Herpes Zoster. It is the same virus that gives you chickenpox. And if you've ever seen anybody with chickenpox, you have this rash over your entire body, and then it goes away. But when it goes away, it doesn't totally leave your body. So it stays inside in these nerve collections called ganglia. And if you get weakened, if you get immunocompromised, if you're under stress or some other kind of problem, they can come out. The difference between shingles and chickenpox, though, in terms of the symptoms and signs, is when they come out in what's called a dermatome. It's like a wedge-like distribution. It's only on one side of the body. It can be on your chest. It can be on your side. It can be on your face. In the case of Lin-Manuel Miranda, he had it in his head, and he wrote, I mean, of course, he's always funny. He goes, hey, cool story. First he said, damn, I've got the worst migraine of my life right now. That was yesterday at 10:06 a.m. Today, 4/5 at 10:07 a.m. He said, hey, cool story. This isn't a migraine, it's shingles. Caught it early, quarantined away from the baby in a phantom mask till further notice. So phantom mask, I'm assuming it was sort of, on one side of his face.
Where he may have shingles. He may have shingles on his face. No, but I don't understand, why does he have to be quarantined if it doesn't sound like it's contagious?
Okay, so well, it is contagious. So there are a couple of things. First of all, I want to point out that it can be very painful, but the pain can come before the rash. And that's probably, and it can fake you out. So that's probably what happened with Lin, is that he had the pain, he thought he was having a migraine, and boom, the rash comes out. Now, that rash is very contagious. Until it's crusted over, it's weeping, it's got the virus in it. Now, he's got two babies. He's got a 2-month-old and he's got a 3-year-old. The 2-month-old is at risk of catching chickenpox from those weeping vesicles, because the first dose of the chickenpox vaccine is not until you're 12 to 15 months. You get a second dose at 4 to 6 years.
Okay, so this is what's really interesting, is you have to have gotten chickenpox in order to get shingles, or
you got the vaccine, which is a live attenuated means weakened vaccine, form of the virus. So when you get that, don't make the mistake of thinking that you're at increased risk of getting shingles from the vaccine. The vaccine actually decreases your odds of getting chickenpox, full-blown chickenpox, and decreases your risk of getting shingles, but you can still get shingles after having gotten the vaccine.
And there is also a shingles vaccine. Who should get that?
Correct. So the C.D.C. says there is an older one and there's a newer one. Let's focus on the newer one because the C.D.C. is recommending this. It's called Shingrix. It's for people who are 50 and over who are immunocompetent, meaning that they don't have some sort of problem where they can't handle a vaccine. And it's very effective in the trials of about 17,000 people. 2 doses. One dose, and then the second one is a booster 2 to 6 months later, about 97% effective. It's still early. I'm an internist and gastroenterologist. I've been giving it to my patients just starting this year, and they are having some side effects of it.
How big of a deal is it to get shingles? Are there long-term effects or complications, especially in an elderly population?
I want to talk about the side effects, but since I mentioned the side effects, I just want to say that people are reporting they're having some pain at the site, and they're getting some flu-like symptoms. So I think we'll have to see, how well it's tolerated, but it's very, very effective, more effective than the old one. Now, in terms of this problems with getting shingles, there's a condition called post-herpetic neuralgia. And in plain, simple words, that means you get the shingles, the rash may go away, but then you have this pain that can persist for weeks, months, even years. And there are patients of mine who have had it every second of every day for months and years. It just can drive people out of their minds, and there's all sorts of attempts to treat that, but it can be really hard to treat. So the bottom line is, the reason why the C.D.C. is recommending getting this new vaccine is to try to prevent not just shingles, but the post-herpetic neuralgia. In the case of Lin-Manuel Miranda, he's got it, I guess, up in his face, and it could be near his eye, and it could threaten his vision, which is, I'm sure, or I don't know. I reached out to him, but I haven't heard back yet. But I suspect that his doctor or doctors have him on medication, antiviral medication, to try to treat that. So we send our regards and our best wishes for a speedy recovery.
And to anyone, frankly, that has shingles. Dr. LaPook, really interesting. Thank you.
Nice to talk to you, Stephanie.
You too.